RSV is a common respiratory virus. Almost all of us get it at least once in our lifetime, usually as an infant or a toddler, but adults can get it too. And for those adults with underlying health conditions, it can be quite serious. Joining me now to talk more about your risk and how to best protect yourself against it is Winnipeg pharmacist Britt Kural. Britt, so good to speak with you.
Good evening, and thank you for having me.
You know, when I hear about RSV, I immediately think about the risk to babies, not necessarily adults. And I'm not alone, based on a recent survey showing many adults don't think they're at risk at all.
That's very true. And while there is a very strong risk for infants and young children, we're learning more and more that there is a very significant risk for older adults as well, which we're really just starting to learn about over the last few years.
So what can you tell us about the risk RSV poses for adults?
Well, for older adults, especially adults over 75, there is a vaccine that's available that is recommended to help reduce the risk of RSV. And RSV is a viral infection that is similar to the influenza or flu virus in many ways. It circulates in the same time frame, so usually this time of the year, fall through early spring, and it can cause very similar types of symptoms with runny nose, cough, sneezing, wheezing, fever as kind of the mild symptoms, but can cause more serious types of symptoms for older adults or individuals who are living with more chronic type of health conditions such as breathing problems, diabetes, or immune system problems.
Let's talk about those more serious symptoms. When do you know you might need to seek out help when it comes to an RSV infection?
That's a great question. So people who are infected with RSV and have mild infection, it usually does resolve on its own, usually within 1 to 2 weeks. But those individuals who are older or have some of those chronic health conditions, if the symptoms are not resolving within that time frame, or if they become very difficult for breathing problems, certainly seeking out medical attention is the best avenue to go down. And it can put people in situations where they do need to be hospitalized. And unfortunately, quite often that could include intensive care types of hospitalization situations.
All right, we know we're in sort of peak flu season right now. Everyone I know is pretty sick. How can we best protect ourselves against RSV, particularly older adults?
That's a great question as well. So a lot of very common sense precautions that we take with any type of viral infection this time of the year, staying home when you're not feeling well, if you're coughing or sneezing around other people, making sure that you're covering those coughs and sneezes. But the other really important thing to remember is that prevention is really important. And now that we do have a vaccine available to help prevent against this virus, speaking to your pharmacist or other healthcare professional about whether or not the RSV vaccine would be good for you is a great idea, because it really is one of the best tools that we have to help reduce the risk of this virus.
Well, Britt, I want to thank you so much for the tips tonight. It was great speaking with you.
My pleasure. Nice to speak with you as well.